everybody. Welcome to In the Know with Nina. I'm your host, Dr. Nina Crowley. I'm the Director for Clinical Education and Partnerships at SICA, where we partner with healthcare providers to offer body composition solutions. And today I'm joined with Dr. Ann Rogers, who is a bariatric surgeon and the incoming president of the ASMBS, the American Society for Metabolic and Bariatric Surgery. So Ann, thanks for joining me.
I'm ecstatic to be here. Thank you for having me.
So Ann and I have known each other for several years, being on the board of the ASMBS and going to all these meetings. And so we usually join up and joke around. And we thought doing a roast of others on this podcast was not appropriate, but I know we'll find a way to get some laughs in there.
It's probably not presidential, so I'll do my best to hold it together.
You've got a couple more weeks, but I get you. So yeah, speaking of presidential, we're really excited that you're going to be starting your term at the meeting in June. So tell me a little bit about some of the stuff that you're excited for your presidency.
Oh, wow. I don't know where to begin. So the gavel gets passed to me on Wednesday, the
12th.
12th. Thank you. Yeah, Wednesday, the 12th. So the meeting will have already started. It's actually Marina Kurian's presidential meeting, and it is going to be the 40th annual meeting of the ASMBS. Wow. So that's kind of amazing. You know, it's been around for a long time. So it's going to be a great meeting. It's in San Diego. There are going to be really, really great sessions, and 5 of which I'm speaking at. So
oh, wow.
be sure to be there for that. But, you know, for my presidency, we each select a theme, first of all. So the theme of my presidency is going to be ending the stigma of obesity.
Yay.
So it's unlikely to happen, but
hey, you don't know that.
It's something we need to continue working on, definitely. So I'm going to be So one of my big initiatives is going to involve increasing access to care for patients with obesity. My meeting is going to be held in June 2025 in Washington, D.C.
Awesome.
So we're going to have some Hill visits that are going to be set up by our legislative consultant. He's a lobbyist. He's a great guy. And we've gone Chris Gallagher.
Oh, yeah. He is a great guy. We can roast Chris. Let's do that next time.
He's too nice. He's too nice to roast. But, you know, he's helped us many times with Hill visits and talking points and things like that. So I want to make that part of my presidential meeting.
I love that.
I'm going to have combined sessions with our integrated health partners. And I'm going to have a call for abstracts that specifically have to do with stigma, advocacy, and things like that, so that a trainee is going to be selected to get a grant to have their meeting paid for, to come and speak at the meeting. So that's
I love that.
Yeah, it's going to be really good.
The weight bias and stigma in this field it's so prevalent. I was just yesterday actually watching Oprah has done another special, and that's kind of been the focus, and really getting sort of patient story involved and talking through, you know, how impactful people who've experienced weight stigma and how they internalize it. And I actually really, you know, I've been in this field almost 20 years. But really for the first time had that feeling watching that show last night that I think we might be hitting a turning point. It was so, you know, it's on the Oprah channel. I don't know how many thousands or millions of people are watching it, but I think people are really starting to hear the story. And I mean, it's a disease that affects 70% of people have overweight, and, you know, 40 or 42% have obesity. So it's still so strange to me that we have a stigmatized condition of the majority that's affecting us through media and social media. And so I really did have that first glimpse of like, okay, well, maybe there's enough public eye on this at this point. You know, all of us working in this field, the Obesity Action Coalition, working on advocacy for so many years, it's, I think, finally tipping a little bit. So, you know, I think that's actually the perfect year for you to be doubling down on that from, you know, that collaborative approach too, where it's really no longer just like, oh, you're a surgery patient, you're a medicine patient, you're a lifestyle nutrition patient. It's we're all taking care of this complex chronic disease, and it's a continuum. I feel that too pretty strongly now. How about you?
Yeah, you make a good point. Actually, a couple years ago, when Stacy Bretthauer was our president for ASMBS, he gave his presidential speech, and he made this comment that I must have heard it at the time, but I just replayed it for some reason. And he said that obesity is the most poorly understood disease process in the world. And it's really true. It's like you said, it's a majority thing now, and yet we still manage to have bias and stigma. And I think part of that is because we have to eat to live. And so the thought process must be, well, just stop. Okay. But we also have to drink water to live. But you can over drink water, but then you become unconscious. Or we have to breathe air to live, but you can over breathe and then become unconscious, right? So that doesn't happen with the other things that we have to do to stay alive. You rarely eat yourself into a coma. So the perception is that you could just stop. And the biology and genetics are just so much more complicated than that.
Yeah, I think that's so. I haven't heard of that. I haven't heard it said that way exactly. I like that. It's, for me, it's like this ideal that everybody's trying to get to, that nobody's really happy when they achieve either. They talked a lot about that on the special that was sort of in my mind, from that. And just how many people's stories are we going to need to share for people to actually turn and not treat people like it's just so simple, right? Because
Yeah.
again, theoretically, for 70%, they should know it's not that simple because they're going through it too. And so it's such a complicated topic, but I'm really glad you'll be tackling that and having that be the theme of the year. I'm assuming you're bringing in part of the conference will be based on that. You said you're doing some other stuff with abstracts, more hill visits. I think that's great. Having the meeting in DC. I've gone to DC for, several of the hill visits. And I think that's one of the most, like, really, we talk a lot about applying what we learn to practice, but that's it, like, really vividly, where you can apply, like, where it really matters. We feel so disconnected from sometimes the political process, but here it's like they need to hear stories from patients, stories from providers. And when you get to do that, if we can get more people experience doing that at this meeting, I think that'll turn a lot of people from just sort of passive into really active advocates.
Well, I hope that that is the case. It's just that advocacy takes a long time. So it takes a lot of patience. You can't just have one hill visit and hope for things to change. The other interesting thing about hill visits is you rarely are allowed to actually meet with our lawmakers. So what you meet with is staffers who are in their early 20s, and most of them are slender and lovely. So they don't necessarily get it. They haven't, a lot of them experienced the stigma of obesity themselves. So those staffers are the people that actually make things happen because they tell the lawmakers what's going on and what they should know about. So getting the message through to them can be challenging. I remember this one lady asking me, "Well, do you know of any other disease process where patients bring it on themselves and insurance still pays for it?" And I was like, "Well, yes, I can." For instance, in my state, Pennsylvania, there's no law that says you have to wear a helmet when riding a motorcycle, right?
Same in South
Yeah,
Carolina.
it's amazing, right? So if some guy crashes his motorcycle, they don't stop at the side of the road and say, hey, did you bring this on yourself? Oh, we're not taking it. No, you're a multi-trauma. You're going to the hospital. We're taking care. Nobody asks about people with heart disease or anything else. Did you contribute to this? No, we just care for medical problems. So we need to make it clear that obesity is a medical condition, a medical diagnosis, and we have medical treatments for it that should be allowed to be used. It's as simple as that.
Yeah, I was thinking about that. An article came out the other day about just people asking other people if they are on Ozempic, and it reminded me. I'm sure you feel this way too. Being in bariatric surgery, I was in that role for 18 years, and a lot of what we have done and experienced is now sort of being repackaged for the medical world of, this is something new, the Ozempic face, and, people's bodies changing because of extreme or significant weight loss. That's nothing new to us, but it
Right.
is new to like the masses, right? Because I think surgery before this medication boom had happened, surgery was kind of the others, right? People really did, in the most extreme stigma way, think about, oh, that's a person who's in their house and there's enabling people bringing them food. Like they're picturing what we've showed them on the media in these ridiculous shows, like My 600-Pound Life, or whatever they are that I can't watch because they misrepresent what we
They
do.
do. They give us a bad name.
They do. They really do. So I feel like now that this is becoming something in front of everybody, we're able to sort of repackage some of the stuff that we know and we've experienced. But something like that, where in surgery, people would always say, "Oh, I didn't have surgery. I did it the natural way, or I did it on my own." And I always like that
Yeah.
phrase is one that'll get me out of my chair ready to fight.
I
When
know.
I hear that, because
Well,
it's so
even
hard to do that, and it's so brave for people who do have surgery and change their life,
well, they
and
did that
it's
on their own too.
and they've done all of that on their own, and it takes a lot of work to be, long-term successful with those, changes. So
I
I
won't
hate
use
hearing that.
names, but there's a major news anchor who had bariatric surgery who downplays it. Not only he trash talks it. Actually, he'll say something like, "Well, I had bariatric surgery, but I can't recommend it." But dude, you had a great
Oh.
result. What are you saying? I
Hmm.
don't know. It's so nuts. But my Mason lecture, our big keynote speaker is going to be Rebecca Puel, who you may know,
Oh, great.
and she's very well known in the field of bias and stigma and whatnot. And so I'm looking forward to having her say some things that hopefully will change the hearts and minds of at least the people who are listening, if they're not changed already.
That's amazing. Yeah, she's great. I actually just was thinking about her the other day. She at the Red Center in at Yale in Connecticut, they partnered with Eli Lilly to do this whole series on internalized weight bias. Have you seen that? It's
No,
so
but I
good.
have read some of the papers about not just internalized, but how even doctors who treat patients with obesity have a lot of bias. It's
Yeah.
kind of hard to escape.
Yeah, this new thing that they had was really great because it's very interactive. It's videos, it's her talking. It's really to help healthcare providers, get out of that place of, just whether they're in that unawareness of, okay, I don't really know, I don't have bias. I treat everybody the same, getting them into awareness that yes, they do, but even more importantly, getting them into, actively working on skills to reduce that, to make the healthcare setting a more comfortable place, for
Oh, yes.
making patients come back. I mean, this is such an important issue, especially now that we have more treatments for more people, that we make sure that the places that we're offering care are not, making people feel worse,
Right.
reinforcing that stigma, and that people's behavior. I mean, you've seen, I'm sure, have plenty of stories about other providers and the bias they have towards patients and how
Absolutely.
damaging that is.
I'm going to have to look this up and watch some of these videos because you know that our patients have been perceiving stigma and being put down their whole lives. So a lot of them tend to come in with a chip on their shoulder, expecting to get the same treatment, and it's hard to work around that. And
Yeah. Or how
just
many
take
times you've heard, oh, like you're a dietitian and you're not going to just tell me what to do and red pen my paper and tell me that I'm, need to eat, yogurt and
yeah,
fruit all the, whatever. And that
right. No,
they're,
absolutely. A
they're
lot of
surprised.
have asked me if I have had bariatric surgery because they think that you can't possibly get it unless you've been through it yourself.
Mm.
Yeah.
That's a really important point, because it seems like with so many of these things, we can't tell people about bias and stigma. Like they have to experience it themselves
Yep.
to be able to get it. And I know that I'm sure that that's common in other areas of, chronic disease, like, I mean, mental health. That was such a stigmatized condition for so long, and it still is to some extent. Where it was really a long time and lots of advocacy, I imagine, to really get that to a place where it's not as
Right.
stigmatized. And so,
It took a while, right? Yeah.
yeah. So, yeah, you're right. The advocacy is a long game. I know the Treat and Reduce Obesity Act that we've been talking about in this field, we've been talking about it since 2013. Maybe
We were just
even,
on the Hill in March
yeah.
for treat. Were you there? For
Yeah.
okay, I didn't remember,
I
but
mean, I've done the Hill visits and visited those same legislators, their offices, their staff has turned over and moved around, and so it's one of those things where on the one hand you can feel deflated that we've been like, how can they not see? We've been talking about this forever, but I also feel like, you know what, we have persisted, and
yep,
now that there's a little bit of a cultural shift and there's an opening for maybe a different narrative and a different conversation, we now have relationships that we've said, okay, remember me? I've been here every year for the past 10. Like now we have something in front of you that we need to ask for. And please tell me you understand because we've
yeah,
been meeting. So
yeah,
I think that strengthens the idea. Like it's worth doing these
yeah.
Hill visits. It's worth keeping the relationship with your legislators in between so that you can really, have it, you don't just go there to ask for things. You go there just to support and to keep that relationship going too. So,
Well, not to change the subject, but I happen to be reading a book right now called One for the Road, and it's about
hmm.
drunk driving over the last century.
Hmm.
And it talks about what people went through to try to change laws, like what an acceptable blood alcohol level is and things like that. And like, how many people does it take to get run over by a drunk driver? It's kind of
Mm.
like, gun control, another hot topic that I won't get into, but it's just not done. And the minute something bad happens to you or your loved one, you're not done. You're just beginning.
That's a good analogy. Yeah. There was a really severe drunk driving accident here in Charleston a week or two ago where two girls got killed. Got hit, I don't know all the details. Got hit twice by two different drivers who fled the scene. And
Wow.
if the first one stopped, they probably could have been helped, right?
Possibly be alive.
But now we're all getting messages about they're going to have checkpoints and they're going to do this and that, and it does remind you like something almost like strange and odd and severe of the thing that is very commonly happening every day has to
Yep.
happen before people start to really take action. What about all the other
Yeah.
accidents that happened from that, and they didn't have that kind of a story. It's like you've got to have it happen to something different. And I think in the case of obesity, I've always said we've got to find that person who's up here to people. And I mean Oprah, right? Like Oprah she has gone through it, and I think she to me is the perfect example of someone who, if fame and money and the place that she's at, and she's still experiencing something that's so common and so human, like people really should realize that it's not a smarts or financial, like it's not about those things. This is just a very biologic disease state that has all these genetic components with other behavior and lifestyle components, but much smaller if this is happening to people at this level.
Well,
And
one of
so
the
I think
problems,
we finally have our person, right?
she's wealthy. I don't know. We may, but one thing I once noticed is that the AIDS legislation didn't start to take off until it started affecting children. And
Mm,
so we may need to have some
mm,
people bring forth children with obesity to show how they are struggling in school and on the playground and everywhere else. I hate to use them, but it is affecting children, right?
right.
It's
It's I see that too, but I also see a real, like, I think people double down on the parenting card when they see kids with obesity, where they'll say, she had a patient who actually was a OAC advocate who had come to the OAC meeting in September. We knew her, fantastic kid and family and story, but people's comments about that. Well, why don't the parents just control, like, they don't go out and get their own food. Why don't the parents just control it? Like, people really get
Yeah.
extremely judgmental and, forget all of the compassionate human things that it takes to be a parent when it comes to judging someone else's kid. But I think you're right. It's got to affect people that everybody can relate to.
Yeah.
So I'm a big one for stories, and hopefully, I think it that kind of a meeting for you too, having patients involved and sharing
Yeah.
their stories. That's been a shift in the professional world over the past several years, where it's been really impactful to see a patient. We all work with patients every day, but hearing the patient at the professional meeting share their story and how their interaction with the healthcare system has, impacted or even damaged them, I think that's a really important way to share story.
That's a great idea. Note to self.
And providers that have had, I mean, there's a lot of people in our community that we know who've had the surgical procedure, who've had medical treatment, who are engaged in all of that. And I would say there's even maybe even a stronger stigma to admit that sometimes, to say, okay, I'm someone who's in this field and I'm also a patient of this type of treatment. And so that could be another whole,
Yeah.
that's
It's
another whole
it's
angle.
so true. I know so many of our people in ASMBS who have been on those medications in order to lose weight. Even I have tried the pill version of it, and it's amazing how it silences that part of the brain that is telling you to think about food. You actually get to think about something else. And
Yeah.
when you realize how much chatter there is going on in your brain telling you to eat all the time. You can't even think about anything else. It's terrible.
It's really, I mean, I think we've had in surgery people experience that, to some extent too. And now having all these people who really just they didn't have a name for it. So calling it food noise and really talking about how intrusive and immobilizing it can be.
Yeah.
I think the stories of that have been part of the shift in people thinking, okay, maybe this is a little more
Yeah.
biology
Yeah.
than just, oh, they can't control what they eat, which used to be the
Right.
narrative.
As if you want to have obesity, right? You're choosing that. Nobody
Right.
wants it. Yeah.
Yeah. I've heard even Robin Pashby, one of our psychologists colleagues, talks about, maybe even people staying on the medication, even if their weight loss out, or if they're a non-responder or their weight loss outcomes have plateaued, people may be staying on it because of the impact with food noise and the reduction in those thoughts and intrusive thoughts about food and eating all the time,
Yeah.
that would be a reason to stay on it. And I think that's another interesting part of everybody's response to medication or surgery is very different. And it's important that we sort of can tailor that to the person. And if that's a piece of their story that, they're able to do all the nutritional and exercise and behavioral things that they want to do because that's suppressed, that's
Yeah.
fantastic.
And hopefully have these medications get to a point where they're not as expensive as they are now.
Yeah.
Like, it's not unusual for patients who have diabetes, for example, for their doctors to continue them on some low dose of diabetes medication after the surgery as a preventive to keep the diabetes from coming back. So
Hmm.
even if you're at a plateau with weight, you might want to continue these medications just to not experience recurrence of weight.
Yeah. Yeah. And I think even talking about weight recurrence as a concept, I'm so glad to hear that we're sort of adopting that language and not calling it, gosh, the terms of
Recidivism.
recidivism. That was the
No,
worst.
no, we're not a prisoner. I mean, in a way, but we're
Yeah.
not in the
So,
penal system.
and even just, I really appreciate the language around calling it a non-responder,
Yeah.
or a super responder to treatment, because I think another level of bias that we're going to see, or that we're starting to see, is people who, you hear in the media all the time, oh, everybody gets on Ozempic and they lose weight. And so what if you're the person who gets on it and doesn't? I
Justin,
mean, that's a whole nother level
who
of
we blamed.
of shame and blame. And with surgery too, oh, you had that surgery and you still are that size. There's so
Well,
much.
somebody who has cancer who doesn't get a cure, we don't blame them. We feel sorry for them. Why is obesity
We
different?
help them. We try harder to find the next cure. Yeah, the personalized treatment. Yeah.
It's nuts.
Well, I think enough people are talking about this, and maybe this is naive, although I feel like I've been, jaded about it for a while, but I think enough people are talking about this in channels that are reaching more people,
I
that
hope
hopefully the message about, it's not your fault, there's a genetic component, it's biology,
right.
it's not just a personal responsibility problem. I think if that message can start to seep into the
Yeah,
majority, we can start to see some, some movement. And yeah, it might take a long time, and but I think if we're moving over that hill is what I'm picturing.
absolutely.
um I think that'll be a good thing.
Get people to stop hiding. Come on in. It's not your fault. We have treatments.
Yeah. And I am excited to see the collaboration between surgical, medical, and all the other, treatment arms really starting more than they had been in the past, coming together. And so patients will have, maybe more of a home of,
Yeah,
here's where I go for treatment, regardless of which treatment option it is. I think that's really a nice
that's
change in the field.
important. Yeah,
And I
that's
think that's reflected in this meeting. So we're excited for being in San Diego in just a month, so a month from today. But I think, the theme of this meeting, talking about how it's right, the butterfly effect, right? So how surgery impacts all these other areas, and how we're kind of collaborating together. I'm excited to see some of the advancements in that and some of the speakers on those topics.
it's going to be good. It's
It's
going to be
great.
good. I'm looking forward to seeing you there.
Yeah, well, this was a great conversation, and Anne, I know we'll have lots more over the year, and I'd be happy to do any Hill Day advocacy that you need. And if we can listen, if we can turn South Carolina, the state that is one of the last holdouts for surgical treatment for obesity, if we can flip them in your presidential term, that
That
would
would
be something.
we'll sign you up.
All right. Well, thanks. I'll see you in San Diego.
All right. Thank you for having me.